So here I'm going to talk about the type of immune response and type of immunities. First one is immune response is two types, humoral response and cellular response. Humoral response is immediate, but cellular response is delay, or we call delay hypersensitivities. What is humoral response? The humoral immune response is mediated by antibody molecules that are secreted by plasma cell. So this type of responses protect against acute or rapidly developing bacterial or viral infection. And second one is called cell response or cell-mediated response. So this is the immunity is an immune response that does not involve antibodies. And also cell-mediated immunity is the activation of phagocytosis or antigen specific cytotoxic T lymphocyte and the release of various cytokine in response to the antigen. Let me read it. This type of response is active against slowly developing bacterial infection and is involved in autoimmune response, some allergic reaction or rejection of the foreign cell. Example, a patient has both kidney is damaged and stage renal disease, and patient take the kidney from a donor, but the new kidney or the kidney implanted, the patient body reject it because patient body identify the new kidney is a foreign body. Cellular response. Some allergic reaction is a cellular response. Now here, types of immunities. It is two types immunities. Here it is innate and adaptive immunities. Innate immunity is also called native or natural immunities, and it is present at the birth and include biochemicals, physicals, and mechanical barrier of defense as well as inflammatory response. So the innate immunity, it is the non-specific immunity, and also immunity is the defense system with which we gain when a human were born. So it is innate. It protects against all pathogen, and also innate immunity involve the barrier that keep the harmful materials from entering our body. And this barrier from the first line defense in immune system, right? What is the acquired immunities or adaptive immunities? Is an immunity that is occur after exposed to the antigen either from a pathogen or from a vaccination. And this part of immune system is activated when the innate immune response is insufficient to control the infection. So acquired or adaptive immunity is received passively from mother's antibodies or animal serum, or antibodies produced in response to the disease. Immunization can produce active or adaptive or acquired immunities. Here are some example of active immunities and passive immunities. Active immunities is natural or artificial, and passive immunity is natural and artificial as well. So active natural is an infection, is an active natural. So when body produce antibody in response to expose a live pathogen or virus and bacteria, this is active natural immunities. And active artificial, like vaccination. So when body produce antibody in response to the vaccine, it is called active artificial immunities. And passive natural example is the baby get the immunity from the mother, maternal antibodies. So antibody are passes from mother to her baby through the placenta or breastfeed. This is the example of passive natural immunity. And passive immunity artificial monoclonal antibodies. So immunoglobulins, it is called monoclonal antibody. One example, it is the immunoglobulins. Immunoglobulins are administered to an individual after they have been exposed to the pathogen. This is the example of passive artificial immunities.